This is a oocyte retrieval procedure in a woman in an IVF cycle, and this woman had been stimulated with gonadotropins for around 10 to 12 days, and after the trigger, the ovum procedure is being proceeded into. It is done under short general anesthesia, and as you can see, it is done under transvaginal ultrasound guidance with an ovum pickup needle, where the needle is inserted inside the ovary transvaginally, and the needle is under vision seen inside the follicle. The follicle is a structure, cystic structure, which contains the egg, and we aspirate the contents of the follicle along with the oocytes, and this gets collected inside the tube. This is done one after the other, when you can see how the follicle gets collapsed after the follicle's contents get aspirated. And we should be very careful while doing it, because there are chances of injuring the ovary and the surrounding structures, especially the intestines, the blood vessels, and also the urinary bladder. So all this round structures that you see are the follicles inside an ovary, and the echogenic structure that you see is the tip of the needle and the entire needle, which is echogenic and can be easily visualized in an ultrasound. And you can see as it punctures the follicle and goes inside, and we have a suction apparatus through which the switch is put on, and the entire fluid comes and gets collected inside the tube. And this tube is put into a heated block where it maintains 37 degrees centigrade, and immediately after collection you can see the fluid getting collected inside, and immediately once it gets filled up, it is being transferred by the assistant to the embryologist. The embryology lab is usually very adjacent to the operation theater, and within few seconds it has to be transferred into the lab. Now this procedure should continue unless both the ovaries are complete, follicles in both the ovaries get aspirated, and the embryologist gives her the information as to how many eggs they found from the follicular fluid. We expect to get one egg from each follicle. So the entire procedure is done under a very short anesthesia, and it is painless, and the patient recovers very quickly after the procedure is over.